This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, is spinal stenosis serious? If you like this video, we put out new content weekly, so please like and subscribe. So, is spinal stenosis serious? Well, it depends. For some people it is, for some people it isn't. So I'll just say that as people get older, they generally have arthritic changes in their back, and even if they have no pain. So the only people who really have clean MRIs with nothing is abnormal on them are people in their teens mostly, and maybe early 20s. But once you get older, especially 50s, 60s, 70s, you're going to have a lot of junk on your MRI. There's going to be discs, there's going to be arthritis and everything. And so sometimes what can happen if there's a disc or if there's arthritis, it can kind of smush the nerve contents of the spine, and that's what they call spinal stenosis. Now, if you don't have any symptoms and they just found this for whatever reason, but you don't have any pain traveling down your legs, you don't have any bowel or bladder issues, or you don't have anything traveling down your arms, you don't have any problems with fine motor movement or walking, then no, it's not stenosis, it's not serious. Basically, it's an incidental finding, and if it were me, I would ignore it. However, if you have pain traveling down your legs or traveling down into your arms, so those other things that I mentioned, then it's probably causing you symptoms, and I would say at that point, it's worth considering as potentially causing your pain and symptoms. The time when it gets really serious, if it's pressing the spinal cord in the cervical spine, or it's pressing on the nerve roots in the lumbar spine, meaning that it's not just hitting a nerve that's traveling to the leg or the arm, it's hitting actually in the center. In those instances, you'll have loss of bowel and bladder pain, numbness on like kind of in between your legs, or you'll have loss of fine motor movements. That's when I say it's actually very serious and you need to get that taken care of surgically pretty quickly. But for most people, they just sort of have pain, they kind of find X-ray, MRI, stenosis, multiple levels. Without any of those symptoms traveling down, then I essentially ignore it in the patients I treat, because it's multiple level. You could go do a surgery and fuse those levels, and a lot of times they're worse. So you got to be careful with how you treat those types of patients, especially if the pain is mostly muscular. Then you're treating the spine and you're not treating where, if it is muscular or an origin, where the main pain is. So I hope I was able to answer your questions is spinal stenosis serious? If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice over YouTube, because this video and all my videos are for educational purposes only. Thanks for watching.